I'm Susan Dubois. I'm an endocrinologist and I work for community care health centers. And I support this work. Mary and I have been working together for about 10 years now, working with the Texas Drive family. So I'm glad to be here today.
So today we have some questions that we get often from participants that we want to talk about. So one of the things we talk about in class is about medications. And something that folks often bring up is while they're on their medications, they ask, can I get off my medications? How would you kind of counsel that patient?
Well, it depends. It depends on how much medicine you've taken, how long you've had diabetes. For example, if you're new to diabetes, if you maybe don't have a very healthy diet, you've got some weight to lose, some patients might be able to come off medications just with lifestyle. But as you probably know, when you are diagnosed with diabetes, the process of insulin resistance has been going on more than 10 years. And from the time of diagnosis, insulin levels start to fall. And so if you have a condition where you're not producing insulin anymore, then it's unlikely you're going to come off meds completely. So if I have a patient who's on a lot of insulin, they may not be able to come off all medicines.
Right. So considering that we have so many medications to choose from now to manage diabetes, is there a way diabetes can be cured in a sense, not just medication, but like also the physiological effects of diabetes?
There are certain circumstances where people get diabetes and it appears to reverse or go away when those circumstances change. One great example is pregnancy. So there's the condition gestational diabetes where the hormones of pregnancy cause insulin resistance. When you're no longer pregnant, the diabetes goes away, but does it? So women who have gestational diabetes have a 1 to 2% risk of developing diabetes each year. So by 20 years after that pregnancy, they're quite likely to be diagnosed with type 2 diabetes. So the insulin resistance continues. And that's why these patients should continue to follow healthy lifestyle over the long term. We never are able to sort of give up and go back to those unhealthy habits that created the problem in the first place.
Right. And given a patient who is on a medication regimen, but has blood sugars, say, elevated 200s, but they feel fine, should they continue taking medication? How would you counsel a patient in that case?
So I saw a patient yesterday and she said, I think her A1C was about 9.4. And she said, Dr. Dubois, I feel great when my sugar is 200 and 300. Why is that? And my message to her was, I understand that you feel great, but the high sugar is damaging your body. So when our sugar is high, it attaches to proteins in the body and changes them and damages them. And those changes, especially on the vascular level, cause vascular disease. And the best evidence that we have of this is the United Kingdom prospective diabetes trial. So this was a great trial of 5,102 patients. It started in 1977. It went on to 1997. So 20 years they followed these patients and they were randomized to either lifestyle, healthy diet, usual care, we say, or to sulfonylureas or insulin or metformin. And they said what happened to them. And the intensive treatment group lowered their A1C to 7% over this 10-year span compared to 7.9% in the usual care group. That doesn't sound like much, but magnified over 20 years, the patients who had treatment had a 25% lower risk of microvascular complications. So that's eye disease, kidney disease, nerve damage that could lead to amputations and so forth. But the really cool thing is they followed these same patients, those who were still living, an additional 10 years. So after the intervention, so they were no longer in any treatment group. They just said, if you do this for 20 years, what happens in the following 10 years? And we saw a remarkable effect that all that protection was maintained. And in addition, there was a 33% less risk of heart attack in the metformin group. So, and I think about a 12% less mortality. So what happens is if you control your diabetes now, you'll have effects that last long after the intervention. So we should do that.
Right. And this reminds me, so the last year I've been in this program, we've had you join us for our medication classes. One of the analogies that you gave during the first class that I went in with Church 13 was keeping the horse in the barn when it comes to medications. Could you expand on that?
Yeah. So we all know, and I think diabetes is like that. When our sugar is under control, it's like the horse is in the barn. The door is closed. It's easy to maintain with a little medication, and you can, follow a fairly healthy diet and a little bit of exercise and be very, very stable. But sometimes patients will sort of get off the program. They may decide, I don't need my medication anymore because I'm well controlled. They stop their medication, and over time, they're not eating as healthy, they're not exercising, and before you know it, their A1C is 10 or 12, and their blood sugars are in the 300 and 400s. Getting those back to normal is really difficult, and it's harder every time you do it. So if you go through a couple of cycles of getting off the program, it becomes harder and harder. It's like a horse running wild in a field. It doesn't take very many resources to keep a horse in the barn if the door is closed.
Right.
But if the horse is running wild, you got to have several people come there and corral it and get it back in. And so it'd be the same with medicines. It might take 3 or 4 medications to now get that blood sugar back into control. So the earlier we can get the treatment, and I've had patients who have pre-diabetes who I've followed on 500 or 1,000 milligrams of metformin over a decade or two, and they stay well controlled. Yeah. But if you have somebody go away and they're not taking meds and they're not taking care of their lifestyle issues, you can easily see that person come in and be very uncontrolled. And the other thing that that big trial I talked about, the UK-PDS, showed us is that without lifestyle management, you will escape the protective effect of metformin and sulfonylureas after about 3 to 5 years. So so if you watch your diet and you exercise and you take medication, you can have a long-term durable effect.
Right.
But if you just take meds, you can out-eat any regimen I give you or just inject insulin. And so we've got to do them together.
Yes, ma'am.